Hi, I'm Congressman Randy Hultgren. I've been getting a lot of questions from constituents from the 14th District on the future of the Affordable Care Act, sometimes called the ACA or Obamacare. I want to take a couple minutes to address your questions and clear up where I stand on health insurance reform. Scott from McHenry writes, please oppose any changes to the Affordable Care Act. It is working for me. Thanks for the email, Scott. The sad truth is that, as now structured, the subsidized program for middle class and lower income Americans is failing fast. About 21,000 people who live in the 14th District get their health insurance through the AC exchange. All other citizens get insurance through their employers, the individual market, Medicare, and Medicaid. While it's true that some Illinois residents have benefited from the law by getting first-time and better access to health insurance, the cost of that access has to be reined in. Remember, we're only talking about the Affordable Care Act program. Did you know that half of the 14th District was left with just one insurance carrier option this year? One. Now that Aetna and Humana are leaving the ACA market, if nothing changes next year, everyone getting insurance in the ACA exchange in our district will only be allowed to get their ACA health coverage from the one remaining company, Blue Cross Blue Shield. That's what I call a monopoly, and it's not good for anyone. Monopolies set the rules of the road and make no exceptions for individual needs. Without healthy competition, ACA insurers can charge more and more for premiums every year, which will be especially hard for individuals in McHenry County, who saw their premium increase more than 70% in 2017. To make matters worse, if you're on the ACA in the 14th District, you already don't have access to some of the best hospitals in Northern Illinois, like Northwestern Medicine and Lurie's Children's Hospital, nor do you often have access to the hospitals closest to your home. I reject this as the new normal. We should all want a better system, and I won't sit by while my constituents are hit with fewer choices at higher costs. We need to begin the many steps that are needed to bring costs under control and put patients and the doctor in control of health decisions. Here's another email from Kim from Sugar Grove who asks, what are you going to do to maintain health coverage for people with pre-existing conditions? Great question, Kim. I completely agree that we must make sure that individuals with pre-existing conditions and their families maintain access to meaningful, affordable health insurance, no matter the replacement plan. That's why I co-sponsored H.R. 628, the Guaranteed Health Coverage for Pre-Existing Conditions Act of 2017. Jane from Geneva wrote, why not help small businesses who are entirely left out of the ACA? How about encouraging health reform plans that allow small businesses to pool their resources to buy health insurance and to give employers access to tax incentives for their employees? We need to empower the private sector to use knowledge and technology to make the individual health insurance markets more competitive, less risky, and more affordable. I'm very supportive of allowing employers to work together to offer their employees coverage on a private exchange or offer workers health reimbursement accounts to help them buy plans in the individual market. Ultimately, I support choice, and I think more choice will make health insurance more affordable. I've heard loud and clear from my constituents that the Affordable Care Act as a whole isn't affordable, doesn't provide choice, and doesn't serve their needs. Seniors who are living on fixed income can't absorb the annual increases in premiums. Most families getting insurance on the ACA exchange simply can't afford what the law is delivering. It's time to keep what's working and reform the rest. Thanks for listening.